Good day everyone, we are Group 2 and our topic is visual and hearing impairment. So what is visual impairment? Visual impairment is defined as any kind of non-correctable vision loss, whether it is complete blindness or partial blindness.
So what is the causes of visual impairment? Globally, the most common causes of visual impairment are uncorrected refractive errors, cataract, age-related macular degeneration, diabetic retinopathy, corneal capacity, and trachoma. Next is, according to Kevin, noted the following causes visual impairments among children. First is the amblyopia or lazy eye. It's the strabismus. Next is the birth deficits and eye or brain injuries.
So, in the classroom, children who have visual impairments, according to Gavin 2018, may need like 4. So first is to be seated near the board, whiteboard, or visual aid. The second is to wear eyeglasses like mine, or magnified or extra lighting to give in large printed materials or reading or audiobooks. Third, someone assistance in taking notes. And lastly, more time to finish or tasks or comply with the assignments. So second, so there are the teachers may determine if a child has a possible vision problem or the children have like a possible vision problem. So there are 6. So first is the constantly rubs in her eyes, is sensitive with lights, is squinting, constantly closing one eye, or has misaligned eyes, or cannot see objects at a distance, and has trouble reading what is on the board, or lastly, difficulty reading on the printed materials.
So next up, we're going to tackle about hearing impairment, which is the condition which affects the ability to hear. So there are 5 types of hearing impairments. First is the conductive hearing loss. This is most common for children, which are caused by loud noises and like ear infections, most commonly earwax. So next is the sensorineural, which affects the hair cells in our ears, and when it's damaged, it lessens the ability for a person to hear. So yeah.
Go.
Now, we will going to talk about the 3 other types of hearing impairments. Starts with mixed hearing loss. This hearing loss occurs when a person has both conductive and sensorineural hearing impairment. The first one is central hearing loss. This impairment happens when the cochlea is working properly and some parts of the brain are not. And the last one is auditory processing disorder. This is not a hearing loss, but a person who has this can easily hear well in a quiet environment.
Next up, we were going to tackle about the cause of hearing impairment. The common cause of hearing impairments may be a genetic disorder, injuries to ear or head complication during pregnancy or birth infection, or illnesses, medication, and loud noises. The symptoms. What are the symptoms of having a hearing impairment? So these are the following symptoms of possible hearing impairments. So the first one is the child does not respond to verbal instruction. Second one, child asks you to repeat what you said. Now, a third one, the child always raises her or his voice when speaking. And the fourth one is the child is difficult hearing sound. So what are the things that we need to do in dealing with the children with hearing impairments? So we have 7, which is the first one, we need to use visual cues. The second one, use sign language if qualified. And number 3 or the third one, use eye contact. That's most important. Number 4, speak slowly and clearly without shouting. Number 5, demonstrate or show what you want them to do. Number 6, use paper and pen to communicate. And number 7, lastly, we have use facial and body expression to make them feel that they are treated enough and they make them feel that they are cared about. So that's all for our report for today, and thank you. These are the groups.